So I'm going to be testing the active range of motion for the ankle. The purpose of this test is to show what the client is willing/able to do. So first I'm going to get the client to dorsiflex their foot, so put their toes to the ceiling. Then I'm going to get the client to overpressure the foot. And is there any pain with that? No. Then I'm going to get my client to plantar flex the foot. And then I'm just going to apply overpressure. And any pain with that? No. Then I'm going to get my client to invert their foot. And then I'm going to overpressure. Any pain with that? No. No. And then I'm going to get my client to evert their foot. Any pressure or any pain with that? No. And then I'm just going to overpressure. Any pain with that? No. The purpose of this, abnormal results of this are that the client will be limited by pain. My next test is passive range of motion for the knee. The purpose of this is to assess the mobility of the inert structures. So first what I'm going to do is I'm going to raise the knee and passively flex the knee. And any pain with that? No? No pain. Then I'm going to put the knee through lateral rotation. Any pain with that? No. Then medial rotation. Any pain with that? No. And then I'm going to put the knee through extension. Any pain with that? No. Okay. The purpose of this is to find out if the person is limited by pain, or if there is abnormal range of motion or abnormal pain, or hypo or hypermobility. So now I'm going to do my active resisted range of motion for the hip. So first off, what I'm going to do is this test is to assess the strength of the muscles, contractile tissue and to find out if there is pain or weakness in the muscle. So first off, I'm going to get my client to resist against, or to raise against my resistance. And any pain with that? No? Yeah, that's for, then I'm going to get my client to go against my resistance again. Any pain with that? No? Then I am going to get my patient to try to cross their leg against resistance. Any pain with that? No? And then push out to me against my resistance. Any pain with that? No? And I'm going to raise my client's leg and get my client to cross their leg again against my resistance. And any pain with that? No? And push towards me again. And any pain with that? No? And that's for internal and external rotation.
That's the way I feel right now.
I hate to say it.
Weaknesses for this would mean if the hip was weak, it would mean that they'd be lower, that the structures are weak. There could be some neuro or some kind of injury, neuro problem or some kind of injury with the structure. Alright, so I'm going to be testing the dermatomes for L5. Dermatomes lie on the dorsal side of the foot, and in order to test the dermatomes, I'm going to superficially stroke down the leg. Normal results would be that the client can feel. Abnormal results are that the client has no sensation or tingling or or only one side feels it. Now we're going to do myotomes for L5, which is extension of the hallucis. Proper results are that both are going to be both the same. Abnormal results are that one would be weaker than the other. So first I'm going to get my client to extend their hallucis. And any pain with that? No? And both are the same strength. Alright, now we're testing the Achilles tendon for reflex. So first what we do is we bolster the ankle. We tap the Achilles tendon. Normal result is that there will be reflex. Abnormal result is that there will be no reflex or prolonged reflex. And reflex right away, which means that it is good. Right now we are doing the ankle anterior drawer test. This is to test the ATFL. Positive test is that there will be hypermobility and pain. So first what I'm going to do is I'm going to support the ligaments in the ankle, and then I'm going to press down. There is no hypermobility in the ankle.
This test for what I have wrong with my knees, right?
So it is negative. All right. Now we are doing the Eli's test to test for a tight rectus femoris. So first what I'm going to do is I'm going to bring my hand underneath the ASIS. Then I am going to lift my client's leg, and if the ASIS moves, it is positive. If it doesn't, then it's negative. And so I bring it up and fully flex the knee, and because there's no movement, it is a negative test. So this is the patella apprehension test. This tests to see if the patella is can possibly dislocate laterally. We're paying attention to the client's face, facial expression to see if there is any discomfort or apprehension in their face. So we move the patella laterally, and client's face is still good. Any pain with that?
No.
Nope.